mics that are going to be passed around. When I say your name, you can just bring the mics around. You can stand up where you are and ask your questions or give us that feedback. We had lots of Aqmd staff here in case we were going to do the breakout sessions. So if you have any Aqmd staff, you want to raise your hand just so we know. Okay, so if you have any questions going forward, you can locate them. But we'll do it more traditionally, kind of town hall format. But again, we're looking for that constructive feedback. So I'm estimating maybe 15 to 20 cards so far. We're going to not be so strict about time to start, but try to be succinct, maybe 3 to 4 minutes at most. We need time to respond, and everyone wants to, get on with their evening. So we'll start with Sandi, Naiman.
Behind you.
So I think one of the things.
Stand up.
I think one of the things we do need to know. Oh, by the way, my name is Sandi Naiman. I live in Porter Ranch, right near the gas wells. I think we do need to know why the Aqmd did settle for that $1 million, because that's really important. Because that's a drop in the bucket. We need a minimum of 30 to 40 million for the LA County Health Department. We need this health study to include at least 12 miles in each direction from Porter Ranch, Aliso Canyon. We need the researchers to find out every single chemical that was in those wells, both from the oil and the gas. We need a long-term study and someone to pay the medical bills for those with illnesses that occur that are likely caused by the blowout. For example, many people became very ill from the toxins many years after 9/11. How many researchers will be involved? How much will they be paid? What will their backgrounds be? My guess is that funding will run out even before the study begins if the researchers are going to be paid. Have you planned for that contingency? Are you involving the LA County Department of Health in this? People like me didn't go to the emergency room, and I would bet that most of us didn't. We went to our own doctors. I don't see how effective that part of the study will be. Limiting this to odorants doesn't begin to cover the toxins that are likely in those wells. 100 people in this? Really? Out of tens of thousands affected. You need to focus on health problems found in the various areas. For example, the ones right near the wells, people in Granada Hills, people further down in Porter Ranch, and you need to know the wind patterns that occurred during the 4 months of the blowout so that you know, and someone's got to go back and talk to weather experts to find out what those patterns did, especially in that first month before people started moving out. Many people did not call the health department because they didn't have the knowledge or wherewithal. That cannot be the only decision that you use. Thank you.
Thank you, Sandi.
So there's a lot of good feedback there and a lot of questions there, and I'm not going to be able to remember all the questions. I do want to address some of it. Even though this is more formal and these are, you're making kind of testimony and statements, if you have a question, we'll answer, and then you could go on. Let's make it more of a discussion than just, a testimony, and then, we have to go point by point. So we can have that discussion. One thing I definitely want to address is money running out, right? So this is part of the planning process to scope out a study, determine what it's going to cost, perhaps go out for bid to make sure that whoever's going to do it, whatever researchers are going to do it, are committed to that budget for what they say they can do. And just like every project and contract and research project, you know, they stick to that budget. But it's all going to be done in a transparent way. The evaluations, our board is going to have to approve the project. So I mean, obviously there's cost overruns and studies, but all the systems are set up so that doesn't happen. You try to avoid that from happening. I will say that some of the things you mentioned fall within our data integration idea. There is data on the gases that were coming out of the wells. There were samples taken right near the wells. There are other samples taken throughout the area. So some of that data actually exists. A lot of it's on our website. But that, you know, that could be helpful. The wind meteorological data, we were looking at that during the week. We have meteorological experts at our agency, and that's kind of that exposure assessment piece that we mentioned, is looking where the winds were blowing at certain times and estimating where the emissions were going and what the exposures are. So, again, I'm sure there's going to be lots of comments on $1 million isn't enough and what happened in the settlement. I'm not going to be able to answer those questions, because I don't have all the answers. I don't have the answers. I wasn't the lawyer. I wasn't in the room when those discussions were going on. But it's what we have to work with, and we understand that more can be done and perhaps should be done in terms of measuring the health. But we have a task here as staff at the agency to get as much out of this $1 million. And again, the leveraging we're doing, we're already looking at much more than $1 million in terms of contributions from other agencies, and we're going to continue to do that. So, Matt Pakucko. So again, if you have a specific question, it's okay to pause and we'll try to address it as quickly as we can, assuming I can.
Yeah. Hi, my name is Matt Pakucko, 10-year resident and president and co-founder of Save Porter Ranch. Boy, here we are again 2 years later, looking at another attempted whitewash. Now, you all work for Aqmd. Probably none of you were involved in that decision. I don't know if you were or you weren't. That gave us this measly $1 million. But everything we say here applies to you because you work for the Aqmd, and you're going to take this back to your governing board. Because if you are going to be putting on a health study, you need to be able to put on a health study of some sort based on the real issues, not this silly stuff we just saw on this display here. Come on. One thing you're probably going to hear from other people tonight is one bottom line is what we think how this health study should be done. Give the community the $1 million and let us do it ourselves. Quite honestly, we don't trust you. We don't trust the Aqmd governing board. We don't trust our own health department. Sorry, Katie. We don't trust any government agency, any elected official. We've been 2 years later, and you're looking at starting a year from now. Come on. Let us take care of business. Now that's, talk about trust. That's all, stuff from the past. Going forward, looking at your own study, come on. You're gonna study people's health based on not an insignificant number of people, and based on calculations of toxins that were measured by various agencies. One thing that every agency, including yourself, including the health department, failed to realize during the blowout, you all tested all sorts of air samples and said, everything's fine. It's all within normal range. But there's thousands of sick people. Now we're going to do that again? Serious? Are you seriously going to do that again? Look at that old data. And you're going to come back to us and say, look, it's within normal range. Except for it may be these 100 people that you're going to ask some questions. Here's the question. Are you actually going to test people's bodies, tissues, health, see what's going on with their physiology? Anything like that?
That could be part of the health, the assessment, the clinical assessment. That was part of that. We put it up as an option because our working group and even some others have mentioned that doing a better exposure assessment was maybe something that would be useful to the community. Could be very useful if additional studies were done later. But from your perspective, if that's not useful, we need to hear that. We need to hear that. Nothing's been decided. So when you're looking up at the screen and looking at all that, we haven't decided on these things. We're here to hear from you what you think would be useful.
Okay, and your thing already says, it already looks rigged, because you say, after all this testing or whatever study you're going to do, we cannot say whether the exposures caused the health symptoms in a specific person, which is each specific person. So here we are, you might find out we're the sickest community on the planet, and you just don't know what happened. Yet we're sitting next to the biggest blowout in history. But you have already rigged your study by putting that disclaimer in there.
That's just a fact of the state of the science, that it's very difficult, if not possible, to look at a particular symptom that has many causes and then look at an exposure that could have caused those symptoms and tie the two together definitively. That's a fact of epidemiology, a fact of toxicology, a fact of the health sciences.
So when you find out this is the sickest community in town, then what are you going to do about it?
Well, I mean...
That's not your job, I know.
Well,
Got it.
I mean, there's... One of the other questions was, are we working with LA County Public Health? We are working with LA County Public Health. There's other litigation going on that we're all aware of. You know, this data could be used if there are findings to, you know, to get those types of mitigation measures. So we're trying to provide that useful information with the resources we have.
No, I'll echo what Sandy said. A lot of people, probably the vast majority of people, did not go to hospitals or emergency rooms. You need to be going to people's doctors and finding out all the data from doctors. You're going to find a hell of a lot more data there. Oh, and what about, there's also if you're working with the health department, UCLA did a study that the health department took over at some point regarding, I think, winds and stuff like was already mentioned. Where's the results of that? Seems like that's a big missing. No one can find that study that UCLA did that the health department took over. That was during the blowout. So we need that information.
I have not seen the results of that study.
No one has.
Nobody has. And that's our tax dollars paid for that through the health department that you're working with, supposedly. All right, yeah, that's it. My whitewash comments, thank you.
Thank you, Matt.
Okay, next we have Patty Glueck.
Okay.
Okay, back in October 2016, the Aqmd convened a panel of health experts from many agencies and universities to design a health study. But lawyers disrespected these health experts and disrespected the health crisis we have here in the northern San Fernando Valley. Not just Porter Ranch, but all these other communities. And that's 500,000 residents. And don't forget, the public health department received health complaints that they attributed to the blowout to a 12-mile radius. That's 1.5 million residents. You hear that? Who've been exposed to the emissions from SS-25 and from further leakage at Aliso that is still ongoing. And we know, a couple weeks ago, we all felt it. Now, I all of a sudden was feeling tired and was coughing, and my husband and I were both sneezing, and I didn't know at that point that there was a massive leak going on up there. And they didn't notify us at all until some of us went on Twitter and said, what's going on? Here's the screen grabs. And we were sending it to elected officials, to your agency, other agencies, to the media. And I all of a sudden got a tweet from them saying, oh, well, it's just venting, and we're going to notify you. And they didn't even notify us until a few hours later, and they probably wouldn't have unless some of us were tweeting about it. So what's going to be done with this $1 million? Send out a postcard to each resident asking them to check out the yes, I'm healthy, or no, I'm sick box? Like, it's ridiculous. And many of us have been out of town to relocate, or like me, I was out of town several times during the blowout, and a couple months afterward. I always felt better after being out of town for a few days. And I was places where there are diesel trucks, San Francisco, places like that, Santa Rosa, where there are trucks and there are the same pollutants. So it wasn't what was said here. And it's not just the mercaptans, it's not just the methane. And I keep seeing odorants. It's not. That's just one element there. It's the toxic chemicals that Salco Gas refuses to name. Some who knows how many, but they refuse to name it, and that's what you need to find out first before any kind of study is done, because that is the missing info, that's the missing link. And it's just a shot in the dark to try to figure out, oh, well, let's just see what's in there. You need to know what chemicals to be looking for. And that's what Salco gas, in what I consider a bad faith action, is not revealing. We keep mentioning this. I mentioned it several Aqmd hearings, the hearing board hearings. And at every hearings, LA Council, whatever, I mentioned that, but it falls on deaf ears because no one is willing to say, hey, we have a health crisis, you need to tell us this information. So we need 4 things. We need Salco gas to say what these chemicals were that they've used, that Getty Oil used even before that, that was used in the fracking soup that attained this gas in the first place. We need a true health study that's undertaken for the entire northern San Fernando Valley, that our area is completely contaminated of these toxic chemicals. But the first thing we need is for this Aliso Canyon gas storage facility to be closed down so it stops poisoning gas. So thank you very much for listening. I hope you take back and say to the governing board, you folks screwed up and screwed us. Thank you.
Vikki Salmela, is that right?
Salmela.
Salmela.
My name's Vikki Salmela. I've been a resident for over 14 years here in Porter Ranch. I didn't pre-write anything, but I agree with most of the people who have already spoken on their concerns and agree with them. The biggest gap is we don't know what we got dumped on us for months. We need that information, all the way back, everything. Not just deodorants, not just mercaptans and methane. We got dumped with golf balls, we heard, and steel balls when they tried to plug it. Everything that was used in trying to fix those at that well, and everything before it and everything after. There's a lot of chemicals that we have been exposed to. We need to know what the group of them does. And that takes specialized scientific toxicologists. I like to know where you're getting the researchers. Who is picking them? Who is having the say, and who is going to research this? Because you don't put that. You don't put what universities either.
Well, the way we generally do these types of projects is we develop a scope of work, which is what we're trying to do tonight. We would issue a request for proposals that's open up to perhaps any university, any other researcher out there. We'd get a stack of proposals. We would put together a scientific group to review those proposals and make sure they're technically sound and maybe rank them. We would probably include in the community preferences in that scoring. And eventually that would go get executed as a contract that eventually has to get approved by our governing board. But it's a process that we go through with every research project that we fund, every request for proposals that we issue.
This is for the entire United States, because some of the best environmental specialists are not around us, and the people that are around us do have agendas.
We can open it up to the entire U.S. or the world, if it matters.
And personally, I would be totally against the LA County Health Department being a part of this. They have hurt my health more than they have helped it. And I have begged them, I have called them, I have written them. I get nowhere. I'm so upset with them. I can't tell you. And if they're part of this study, it won't impress me at all what you're doing. The 100 people, you guys need to look at the BP oil spill and the Exxon Valdez oil spill health studies. I don't know why the NIH is not involved, but they were watching for 5, 10, 15 years 55,000 workers at the BP oil spill. 100 is a joke, especially when the 100 homes that were tested were not even tested accurately, correctly. How are you going to pick 100 people? There's a lot more than 100 people that were seriously affected by this. And by the time you get to this budget and approval, many of them will not be around here anymore. They have already left, or died, or planning to leave. And those are the sickest, just like with the Casper study. I was still evacuated during that Casper study. I was so sick. I stayed away as long as I possibly could. So the data of the sickest people are not in that Casper study.
So just to touch on that, the 100 people as part of that clinical assessment is an initial estimate. There are probably options within there, like if the clinical assessment wasn't as detailed, maybe there's blood samples but no other types of samples, that you might be able to expand that to 100, 200, 300.
That's still ludicrous when you're talking about 55,000 workers at the BP oil spill being watched and for years, and we have hundreds of thousands of people here in the community that have been affected and have reported symptoms. You're not going to get to the truth. And your scientific note, are you doing a control study? Because that is the way to show that the conditions are higher in this community and area and the 12-mile radius than a control study. And it's easy to do. It's already been started. So there are ways. And I haven't been to a hospital or ER room, but yet I was seriously ill. And it's my scientific, environmental scientist, doctor that knows. And he was the one that suggested, go away, see if you feel better, take the VOC test while you're away. There's easy ways to prove whether you're getting your poisoning from here or somewhere else. Either control studies or leaving a long enough time to get it out of your blood and get retested. And you can live next to a gas station for all I care. I know it will show drops in what we were exposed to. My doctor did too. He was so confident for me to do that. The whole study's laughable. My fear is, because you settled for the 1 million, we'll never get anybody to give us more. We'll never get a really true health study that we really need. Because we were poisoned for much longer than the BP oil spill. Much longer. And maybe it was with more chemicals. Once we find out everything, including the gas that came out that was left in there for years, and everything else. It's very disappointing. It's very disappointing, your excuses. And using local people because they're free is not, we're not going to get anything objective. Because the best environmental scientists and the best researchers are not going to have a motive or be paid off by somebody local. They have to come from far away and they have to be the best. This is an opportunity for scientists all over the world to learn from what we had to go through. We went through something nobody else has before, this mix of chemicals. Why can't we get the best in here that would be glad to come in and research and figure this out and help us? Not the local county health department. I've already had it with them. They've done nothing.
Like I said, there's no reason that we have to stay local in terms of the researchers.
How are you going to be able to afford them in the 1 million?
Well, we have to define a scope that's within 1 million. We do think there is some useful. It's not going to give all the answers. We know that.
And
but
why hasn't the NIH been notified?
You consulted with scientists at the NIH as well.
Well, the NIH ran the study at the BP oil spill. They're We're still running it.
I know.
Why can't we get them in here?
We spoke to those folks that were doing that to help figure out the scope. And again, you all mentioned originally when, before the court case took its course, there was a larger scope. And in that process, we were reaching out. We were looking at the BP ARCO spill. We were looking at other similar situations, and that's where you've quoted the 30 to 40 million. That's where the number came from. Unfortunately, at the end of the day, that's not what we have to work with.
We pay tax dollars, federal tax, income taxes. Why can't the federal government be involved in here? You're saying maybe the EPA, but the NIH is the one that ran the two big ones. They're the ones that would know more about what those VOCs and chemicals did to those people, both the residents and the workers. I don't understand why they're not here. Why can't you bring in other entities? So you settled for $1 million. That's all we get? The federal government will not come in? Who's responsible for not getting the federal government in on helping this?
We've consulted them,
I'm not talking about consulted.
Right.
They are running the health study.
I understand. And the health study, I think, in that case, I don't know if it was federal funds or taxpayer funds or whether it was, part of the settlement.
Of course you don't know. I think you need to know that and to help us. If you really want to help us. Those are questions we all have. Why aren't we getting more help from other entities?
So Joke is letting me know that the money originated with BP in that case. We will reach out. You're giving us good feedback. I don't know how NIH would be able to come up with the money for something that you guys are requesting that has been scoped out previously. We've asked. We will ask again. We reach out. We reached out not just to local agencies. We reached out to state agencies about in-kind contributions and funding. We've been working. Part of the reason why, as you mentioned, 2 years, is we've been working to supplement the $1 million with other funding to try to put together a package. We didn't want to wait any longer. We haven't been terribly successful on financial support, but we have gotten some commitments out of, and hopefully some more commitments out of agencies to do other pieces. So that's what we've been working on that.
Well, you guys really missed the boat and really sank us. If you got BP to put those kind of millions of dollars in to a correct health study, but you couldn't do it with SoCal Gas and Sempra, that's insulting to our community.
So next is Susan Gorman-Chang.
Hi, Susan Gorman-Chang. I do have some information about the Gulf study. It was $34 million over 5 years, designed to continue up to 20 years. The National Institutes of Health contributed $10 million to fund the initial phases. BP contributed an additional $10 million to the National Institutes of Health. So some questions. I guess you're familiar with that study? And familiar with the sister study as well for breast cancer? So I would, in a perfect world, I would like to see that kind of protocol for the Gulf long-term study or the sister study. And also, cancer has a latency period of, 15 to 20 years. It could take that long to show up. So I just want to ask a question under your two options, 1 and 2. How is that accounted for, or is it accounted for?
No, I mean, one of the limitations of having the resources that we do is it's very hard to do a long-term study. If we had more resources, that was something we were looking at, but with these resources, it's not going to be long-term.
Is there any way